My name is Jessica, and I'm with the Avalon Foundation in Easton, Maryland, and we are proud to be partnering again with Choptank Community Health to bring you COVID answers. We're going to get together a couple times a week and give you information that is local and timely about COVID-19 and the pandemic here. And it is my pleasure to be here today with my friend Megan Wojtko from Choptank Community Health. Megan, will you introduce yourself and tell us a little bit about who you are and what you do at Choptank Community Health?
Sure. Thank you, Jessica. My name is Megan Wojtko, and I'm the Chief Clinical Officer here at Choptank. I'm also a family nurse practitioner and have been taking care of patients at Choptank for over 8 years now. I would say that I am very passionate about primary care in our community. What else? I've lived on the shore for almost 15 years, and as my role as Chief Clinical Officer, I oversee our clinical operations across our 6 health centers and our community-based program. And really, since the beginning of the pandemic, I have lived and breathed COVID. So my goals always—
Hopefully not really breathed it, right? You haven't really been breathing.
Not yet. I wear my mask, so it's okay.
Tell me about, so a lot of things have been changing after the holidays. Can you give us just a little bit of a characterization about what you're seeing in your offices and across the shore right now? Today is Friday, January 7th, and I know that there has been really a post-holiday surge. We can classify it as that, right?
Definitely. No, we are seeing tons of COVID positive patients and staff, unfortunately, particularly since Christmas. Omicron hit when, we were gathering and we're indoors because it's cold. Our testing has increased tremendously, and we are seeing alarming positivity rates across all of our health centers. So those are very local numbers, and we know that it's here. We know that it's spreading really easily within households, and I would say that you can safely assume that if you are in a restaurant or in a store, that someone in there has COVID. With that being said, I do think that there's some positives and that people want to get tested so they know and they can isolate. So say that's a good thing.
Do you characterize the positive cases that you're seeing being across different age bands? Like, is everybody kind of getting sick right now?
Everybody's getting it. And I went through almost 50 results this morning. More than half of them were positive, and the youngest, I think, was 6 months. There was the oldest, I think, was in her 80s. So it really is across all ages. Now the severity, I know there's been a lot in the media about less severe cases, and I think that's true for those people that are, fully vaccinated, boosted, that are, don't have a lot of other health complications going on. Depending on the age, there's a lot of different factors there that we are seeing less severe cases. But even when we say less severe, it's still kind of kicking people's butts. And so
nobody wants to be sick. That's for sure.
Well, and I think a lot of people forgot how to be sick because we've been well for so long.
That's a really good point. So we've got a lot of different topics that we want to address here in the month of January, and people can certainly email their questions to info@choptankcommunityhealth.org. But kind of where I want to start us off going into the weekend is something that I feel like I'm hearing a lot from people. If you are able to get a rapid test at home and you receive a positive, if you test positive for COVID with a rapid test at home, what should you do? Like, freak the heck out and start calling your medical provider? And what are kind of the next steps? It's like, if I'm at home and I'm not feeling well and I do the rapid test, what should I do?
Sure. I think a quick panic and freak out is very understandable internally. But then you really have to get your game face on, because you can handle it. And, this is where the information is out there. The CDC actually has some really good, friendly, easy to understand handouts that maybe if there's somewhere we can post them. Because really the shift is going away from the health department and your primary care provider kind of telling you what to do, and the CDC and all of us, because we are all stretched really thin, are really asking those positive people at home to do as much as they can to try to handle this.
So right out of the gate, if I test positive, who do I need to call? Like, the case rates are so high, this is not really about contact tracing like in an official way anymore, but like, what would you do if you tested positive, or if your kid tested positive? Who do you think you need to, if you're trying to do the right thing, who would you notify?
So ideally, you still want to let the health department know, and you might leave a message and not get a hold of someone, but it is the kind of right thing to do. And then I do think that the state's working on a better way to self-report. So when that comes, that'll be a big game changer. The next thing is that you need to, think of how to do your own contact tracing. Who have you been around, or the positive person in your household? Who have they been around? And it's the 48 hours or 2 days before your symptoms started. So, you want to get a calendar out and say, okay, my symptoms started here. This is the time that, I could have been infectious. These are the people that I was, in close contact with. And I'm going to call them and let them know, and, kind of make the suggestions, which again, the CDC has handouts. They even have blurbs about like, how do you tell your friends that you were positive?
But it's like, if you know that you've had your mask on, your KN95, and in your meeting with your boss, like, you should still let them know. Basically anybody that you've been around for 15 minutes within 6 feet, is that still what you consider to be a close contact?
So yeah, it's a little hard right now, because anytime you talk about an exact number like 6 feet or 15 minutes, there's a range, and that was like a best guess for most cases. And
so use your common sense.
Use your common sense. If you think that you are close enough, and right now you just want to be safe, let that person decide what they do, but you should kind of just let them know.
And with some of the PCR testing being hard to come by, if you test positive with an antigen test, do you really need to go have a follow-up test, or should you just get in bed and relax?
That's a great question, because earlier on we were kind of confirming with PCRs, and there can be more false results with the antigens if there's not cases all around you. But with our numbers, if you get that positive result on the home test, even if it's a really faint line, that's a positive COVID, and you need to treat it that way. Especially
if you're feeling punky, right? Like, if you have any symptoms and you're testing positive, you can pretty much assume you have COVID and lay low.
Right.
So what kind of advice do you have about how people can take care of themselves at home? Are there over-the-counter medicines that you think that they should have? Is it like chicken soup and Gatorade? Like, is that what?
Yes.
Is that the prescription for this?
It goes back to the good old stuff. You want to, treat your symptoms as needed with the over-the-counter medications. Of course, rest, staying well hydrated with water. It gets a little tricky if you're having difficulty breathing, chest pain. Those are signs that you could have more severe disease, and that's when you would want to go over to the ER. But without those type of symptoms, then you really want to try to stick it out and think of it like other viruses that you may have had in the past, and kind of take out that anxiety of COVID.
And I think that that's what we all need to kind of have, that reality check reminder. Right? I'm so glad to be talking to you today to kind of have that. It is like, we've had colds and viruses before, and we do sort of know some of those common sense ways to take care of ourselves. At what point do you think people actually do need to call their primary care physician? Or if it's over the weekend, when should you be going into urgent care, or even more like the ER? What kind of signs tip the balance between staying in bed with the covers over your head and needing to seek active care?
Right. So I would, again, kind of put my pre-pandemic hat on. And if you had any type of virus, cold, flu, and you were doing the over-the-counter, and, in that case, you would say, what, I really need to see my primary care provider, because something's not right, or I need something stronger. Those are times to call the primary care provider. Of course, if you have questions on isolation or, dates, then that's a reason too. But I'll tell you, if you go looking on the CDC, they really have things outlined for you where you'd be able to figure it out yourself. And then as far as same thing with urgent care on weekends, if you feel like you can handle it at home, I would handle it at home. If you have that difficulty breathing or chest pain, you go to the ER. If it's somewhere in the middle there that you need a little bit extra, then that's when you would seek those other services.
At that point, is it more about duration than severity? I mean, again, if you're having chest pains or you have an extraordinarily high fever or can't breathe, then that is an ER. Like an urgent care would be a high fever for multiple days.
Well, I think that you can think of urgent care as access outside of your primary care business hours, or if they're packed. I think at this point, it's really all in the same of, just needing that extra attention or reassurance if you feel like it's over and beyond what a normal virus should be treating you.
Thank you so much, Megan, for your time today. I know how incredibly busy you are. At Avalon, all of us are so enamored of our healthcare heroes, and we really do understand just how much you guys are up against. And I appreciate all of the advice to use that pre-pandemic common sense to take care of yourself as you have before when you've had a virus, and that if you get that COVID diagnosis at home, it is not the end of the world, and you just need to be responsible and let some people know that you have been ill, and monitor your symptoms and just try to lay low and get better. Did I sum it up for you, Megan?
Yeah, I think so. I mean, there's a big difference between those that are boosted and fully vaccinated and not. And so you just have to do your personal risk assessment, and kind of make decisions accordingly.
That's terrific. We're going to be back with Megan 2 times next week to answer some of your questions about COVID-19. We wish you all well. And again, you can drop us a line at info@choptankcommunityhealth.org. We'll see you next week.